helicopters flying overhead, probably about 22 police officers with masks. There was kids screaming, patients agitated. Everybody in the office had to put their hands up. Our cell phone was confiscated. The allegation is over prescription of pain medication and insurance fraud.
Since January of 2017, we've charged nearly 200 doctors and another 220 medical personnel for opioid-related crimes. 16 of those doctors prescribed more than 20.3 million pills illegally, just 16 of the doctors. In this latest operation, with the help of our fabulous partners at HHS, we've charged another 162 people, including 32 doctors, with illegal distribution of opioids. Some of our most trusted medical professionals look at their patients, vulnerable people suffering from addiction, and they see dollar signs.
During the raid, they took my car, all the cash, all the checks I had in the office, they were all taken. My personal and my business bank account taken. I could not pay my employees, and then I had to rely on people to bring me food. Luckily for me, that a lot of the patients were extremely supportive.
Told me that I would lose my clinical privileges if I continued. The idea being that if a patient died of an overdose, family members would sue the hospital saying, how could you let this idiot physician prescribe these doses when here we have these CDC guidelines that say, no, they shouldn't have been getting more than 90 milligrams a day. They're terrified because if they're like most physicians, they work for a healthcare provider, and those organizations provide you clinical privileges. If they deny you clinical privileges, then you can't practice medicine at that institution at all.
I don't believe the real driver here is that doctors are afraid of the government, that there are doctors who really want to give these patients lots of opioids, but they're worried that they're going to get into trouble with their state. But the real driver here is a change in the culture of prescribing. Your average doctor beginning to recognize that we made a mistake. When we talk about opioid pain medication, we're essentially talking about heroin pills. Opioids are lousy drugs when taken on a long-term daily basis for the vast majority of people who have chronic pain. What policymakers were hearing was that these problems are limited to so-called abusers, but there are millions of people with pain who need these medications. This was never true. It was never true that the harms were limited to so-called abusers. I've spent 15 years treating opioid addiction. I've treated many people who became addicted taking opioids as prescribed.
With the opioid epidemic, just one practitioner that's operating kind of outside the law can wreak havoc. So we use data analytics. So we have databases in DEA coupled with other databases that other federal agencies have and state and local agencies have to see how many prescription pills are going to, let's say, a pharmacy. So we'll take that data and we'll try to get what's called prescription drug monitoring program information. And that's information that the states have at their level that shows how many prescriptions are being written by a doctor for a patient and being filled at a certain pharmacy. So we'll try to look at that stuff and then maybe go out to that pharmacy and do an inspection warrant. And it's possible from doing that inspection warrant, that could be something that we then go on a criminal route on a case, or it could be we educate that pharmacy owner who's a DEA registrant to make sure, hey, you need to follow the regulations and conduct your paperwork in a better manner.
We are making real progress on the prescription drug front. The President issued us a directive to reduce by 1/3, or at least 30%, the amount of prescription opioids out there in America. We are way above the world average, really irresponsibly so. We are prescribing too many. So this year we expect an over 11% reduction. Last year was a 7% reduction in prescription opioids, and we expect it to go down.
Between 2011 and 2017, deaths from heroin, typically admixed with fentanyl, have gone from 7,000 to about 40 or 45,000. So the new opioid crisis is a crisis in the street. The idea that you can somehow solve this problem by limiting prescriptions for patients in chronic pain is obviously ridiculous, but the pressure is still on.
Doctors have sometimes tough decisions to make. If you prescribe too much of an opioid, people do become addicted. It's just plain fact. It's a powerful addiction. It leads to the death of many people. It is really a terrible thing. But good opioid prescribing, it can be essential for people.
If you were to have a medication like an opioid over time, you might find that dose to become less effective, and you might need higher doses in order to have the same benefit. And that's the development of tolerance over time. Your body becomes more tolerant to that medication. Dependence would be that you're taking the medication, and if it were to be stopped, you might have a withdrawal reaction. You'd feel not so well. Those things are distinctly different from an addiction disorder, where the patient is going to take the medication, even if he or she knows the medication has some harmful side effects, but they're willing to take those risks and continue to take more and more medication despite the known risks to them.
I think that physicians who had been managing patients with pain always felt that it was the right thing to do. I mean, relief of human suffering seems to be part and parcel of the Hippocratic Oath. They're left to suffer. Many of them lose jobs, many of them are rendered bedbound, marriages break up, friends are lost, and some people do go ahead and commit suicide. I don't think there's anybody that's provided comprehensive pain care that hasn't lost a patient somewhere along the line.
Pain management, it's not just a job for me. It's a passion.